Doctor, thank you very much, and good news on the report on the patient. That's what this hospital is about, is caring for people, and great to see that they did so well under difficult circumstances. It's very comforting to me as a Kansan to know that the KU hospital is here, and it has the ability, the facilities, and most importantly, the personnel, the staff, the nurses, the doctors, and others who are willing to step forward and care for people who have illnesses and challenges in their lives. So one of the reasons I'm here today is to meet with those staff members, with those nurses and doctors, and to say thank you to them for doing their jobs so well. The other reason I'm here is related to my job as United States Senator, and that is I am the lead Republican on the Appropriations Subcommittee for Labor, Health, and Education. Health would include the Center for Disease Control. Our committee, chaired by Senator Harkin of Iowa, held a hearing a little more than a month ago in Washington, D.C. on the topic of Ebola. Things have changed, in my view, significantly since that hearing occurred. There, the focus was on West Africa. Now we know with presentations here in the United States, certainly in Dallas, that this is an issue that has domestic implications for the health and well-being of Americans. And so while initially the committee was looking at what do we do to make certain that international relief efforts, healthcare organizations, the CDC, the National Institute for Health have the necessary resources to combat Ebola, both as a public health issue, but also as a scientific medical research issue. That hearing focused on West Africa, and I wanted to be here today to know what's going on front and center, front line here, as we try to care for patients who may present themselves with symptoms that would suggest Ebola. And then, as equally important, is to make certain that the rest of the public has a sense of confidence in that ability, and that public health and welfare is protected. I had the opportunity to do both of those things today with some specific requests and suggestions from healthcare professionals here at KU Hospital. I had the opportunity to say thank you to the people who work here and cared for this patient and others. And I have some suggestions and ideas of things that we should do as a nation. And if I could just briefly outline what those are, and then I'm happy to go to questions. First of all, I've said for a long time, we need to do a better job of determining who enters the United States and what their health condition is. And so certainly people who are coming from West Africa need to have the attention. And we need to make certain that healthcare professionals who go to treat patients in Africa and to try to contain the circumstance there can come back to the United States. But if you are originating from West Africa, you need special attention before you enter the United States. We have pushed the CDC, the FAA, the TSA, all the agencies that are involved in travel to the United States to step up their efforts at screening and potentially banning people who present, who are attempting to come to the United States from that area. I believe from the beginning and continue to believe today that containing Ebola in Africa, in West Africa, is the best defense for the public health of citizens of the United States. So it involves a United States and international effort, in my view, to contain, to treat, and to eliminate Ebola in Africa. And while that's of great benefit and importance from a humanitarian point of view, as Americans have demonstrated time and time again their willingness to help and care for others around the globe, it's also important from a public health point of view here in the United States that if we're not successful in containing Ebola in Africa, in this global world, in this global economy where travel is prevalent, there are consequences around the globe. And so as part of an international community, but as important as Americans, as American citizens, we have a humanitarian, but equally a public health care reason to combat Ebola in West Africa. So travel to the United States needs to be front and center. Our efforts need to continue in West Africa to reduce the scope and expansion of Ebola to patients there. In my view, we need to make certain that we, on a front here in the United States, continue our efforts to make certain that the Center for Disease Control has the necessary resources. That means financial, but it also means scientific and medical expertise to make certain that we have the standards in place that determine what public health requirements should be. We need to make certain that states have every piece of information necessary to provide public health in those states. Kansas and Missouri need to make certain that their public health officials are provided with the latest information, and perhaps even more importantly, that when that information is obtained, how it's disseminated to healthcare professionals across our state. I'll be looking at the issues of what do hospitals across Kansas know, what does an emergency room physician or nurse in a community hospital in any community in our state, what is their current level of training, expertise, and knowledge. It's also important for the person who is involved in emergency services. So information is important, and information that was learned in Dallas was used here to make certain that we were doing everything properly. And out of an abundance of caution, this hospital responded in a way that was very protective of others while caring for a patient. So the resources are necessary. Senator Harkin and I have had conversations. Another hearing is in the works, sometime expected in the next 10 days or so. We expect to have an appropriations hearing to determine what resources the CDC, NIH, and other agencies require in order to meet the circumstances that we face in this country with Ebola as we continue to battle it globally. So I would say that on a multi-front, we have responsibilities and opportunities to make certain that the public is well cared for. And what I would say finally is that my visit to KU Hospital confirms to me that patients should be willing, happy, should feel very comfortable in presenting themselves as patients to KU Hospital. And if there is somebody who has a medical need, the place that they still need to come is their local hospital. It's not calling the University of Kansas Hospital. It's not calling KU Hospital unless this is your community hospital. It's going to the physicians of your choice, the hospitals of your choice in your hometowns across our states, Missouri and Kansas. And it's making certain that everyone feels comfortable knowing that health care can be provided in a safe environment. They should very much feel comfortable about presenting themselves to their local hospital, and I would encourage them, if they have symptoms that are worrisome, they should call their hospital ahead of time and indicate that they're coming, so that the hospital is prepared for that patient's arrival. I believe I'd be happy to respond to questions unless there's something you'd like to correct that I said.
Do you have any, what's your level of worry about potential holes in our defenses, if you will, that would allow somebody with Ebola to get in and not get, screened or not get stuff?
Well, I certainly think we have a long way to go before we can have a level of comfort that is adequate. I think steps have been taken. We have a very, in a sense, bifurcated, it's a federalist system. Most public health efforts are accomplished by states across the country. Every state has a public health department that is primarily responsible for the health in the communities of their state, for their citizens. It seems to me that we need to have a stepped up effort to make certain that those individuals have the necessary information and are providing it statewide to their healthcare providers. Where the federal government comes into play, in my role, in my view, is the role of providing that information, the latest protocols, the latest scientific information, the latest medical information. And in addition to that, then there is a significant and perhaps solely a federal role in securing the safety of travel into the United States. So this is certainly a CDC issue in the sense that it provides the medical and scientific information, but it is mostly a Department of Transportation, U.S. Department of Transportation, Homeland Security issue about how to secure the, in a sense, the borders of people crossing and bringing a disease either intentionally or unintentionally to the United States. And those efforts need to be enhanced.